Hello and welcome. Thank you for choosing UCLA for your upcoming joint replacement surgery. My name is Phoeng. I am the Orthopaedic Nurse Navigator, and I will be following each and every one of you guys from this point on until 90 days after your surgery. Thank you for taking the time to watch this video. It will help prepare you for what to do before surgery, what to expect in the hospital, and what after recovery looks like. The presenters for this class include myself, Kelly, an ortho certified nurse, Troy, our physical therapist, and Amy, our occupational therapist. You may meet these presenters after your upcoming surgery. We encourage you to share or watch these videos with the friends and family members that will be assisting you through the entire surgical process. We will cover the following topics in this video: nursing, pharmacy, physical therapy, a rehab demo, occupational therapy, and case management. We will send you several documents that will accompany this educational class, including your surgeon-specific discharge instructions, a copy of the PowerPoint, your hip rehab brochure, hip exercise program, a list of local equipment stores, a fall prevention tip sheet, and an educational piece on intimacy after joint replacement. Before jumping into the education, I want to ask you to please participate in our UCLA survey that will allow your surgeon to obtain baseline assessments on your physical well-being and track improvements to your overall quality of life after surgery. This will allow your surgical team to have all the information needed to provide you with the best possible care and track and monitor your recovery outcomes after surgery. It is important that you complete the first survey prior to surgery in order to be included in the follow-up surveys. This survey will be sent to you via email on file or text message to your cell phone. Please look out for a message titled Tracking Your Recovery Survey. We will also send you a flyer with this information. If you have any questions about this survey, please feel free to call me.
Hello, my name is Kelly. I have the pleasure of being a nurse on the orthopedic unit at UCLA. I'll be taking you through some of the nursing portion of this presentation. Let's jump into the content for our hip replacement surgery. Let's start with arrival time to the hospital. You'll get a call from the hospital 1 business day before your surgery, informing you of your arrival time to the hospital and time of your surgery. If your surgery is on a Monday, UCLA will call you on a Friday. If your surgery is on Thursday, UCLA will call you on Wednesday. UCLA can call any time between 8 a.m. and 5 p.m. 1 business day before surgery. If you need to coordinate the time of your surgery in advance, you can always call 424-259-8060 after 2 p.m. to request your arrival time. You'll likely get a voicemail box where you can leave your number and your name, and they will call you back. If no one calls you by 5 p.m. 1 business day before your surgery, you should call or text Wilson, the nurse navigator, on his work cell phone at 310-295-7403, and he'll let you know the time you need to be at the hospital. Once you have that time that you have to be at the hospital, you'll know when to stop eating or drinking. This chart will give you information on when to stop solid food and when to stop clear liquids. You'll need to stop solid food 8 hours prior to your arrival time and clear liquids 2 hours prior to arrival time. For example, if UCLA calls you and says you need to be at the hospital at 6 a.m., you'll need to stop all solid food by 10 p.m. Again, that's 8 hours prior to your arrival time. You'll need to stop all clear liquids by 4 a.m. if you're arriving at 6 a.m. That's 2 hours prior to your arrival time. Now, when I say clear liquids, I'm talking about water, Pedialyte, Gatorade, and Powerade. These clear liquids will keep you hydrated for surgery. While black coffee is technically a clear liquid, you can run into a problem if you add any creamer or sugar to it, which will make it a solid. Doing that can postpone or delay your surgery. I'd advise you to please avoid a coffee altogether. Additionally, it's a good idea to stick to hydrating fluids. Studies have shown that if you stay hydrated up until surgery, it can reduce some of the side effects from the anesthetics. Please keep this chart handy for a guideline of when to stop eating and drinking before surgery. All of you should be seen by your primary care doctor or a doctor that your surgeon recommends in order to be cleared for surgery. This clearance should be done within 30 days of surgery. At that appointment, you should go over all of your medications that you take and come up with a plan as to when you can safely stop these medications leading up to surgery and when to resume after surgery. Because I cannot speak to each individual's medical case, I'll speak in general about medications prior to surgery. With the exception of blood-thinning medications, which we'll cover in the pharmacy section, You can usually take all of your normal medications up until the night before surgery. On the morning of surgery, we'll only want you to take important medications. This includes some blood pressure medications. You should take blood pressure medications that fall under the class of beta blockers. This includes metoprolol, atenolol, and carvedilol. Unless otherwise instructed by your doctor, you should skip the following class of blood pressure medications on day of surgery: ARBs, ACE inhibitors, and diuretics. This slide includes a list of blood pressure medication classes as well as some common examples. Again, your primary doctor knows you and your medical history best, so please make sure to review your medications with them. I am again just talking in general guidelines. It can be dangerous to perform surgery if you have an active infection. If you have symptoms of an infection such as fever, rash, nausea, vomiting, or diarrhea, or if you've been diagnosed with a urinary tract infection or have a dental abscess, please alert Wilson or your surgeon's office. We do not want to perform surgery on you and allow that infection to spread to your surgical site. Again, please report any signs of infection to your surgeon's office or to Wilson, the ortho nurse navigator. Prior to your surgery, you'll need to shower with a solution called Hibiclens 3 times. You'll use this solution 2 nights before surgery, the night before surgery, and the morning of surgery before you leave your home to come to the hospital. You can purchase a bottle of Hibiclens over the counter at any pharmacy. The instructions for using Hibiclens are as followed. First, wash your hair, face, and body with your normal shampoo, conditioner, and soap. Rinse completely. Then, turn off the shower or step out of the bathwater. Pour a quarter-size amount of the Hibiclens solution onto a clean, wet washcloth. Use the washcloth to rub the solution on your body from the neck down. Do not use Hibiclens on your face, hair, or genital area. Apply more soap as needed. Turn on the shower or return to the bath and rinse the solution off your body. Then towel dry. Please do not use Hibiclens if you're allergic to Hibiclens or you've experienced a reaction such as hives, skin irritation, or redness with Hibiclens. If that's the case, you can use regular antibacterial soap. Do not apply any skincare products after showering with Hibiclens. This includes any lotion, creams, deodorants, or oils. I'm going to go over what to and not to bring with you on your day of surgery. Please bring a list of your medications and supplements, as well as a copy of your medical and surgical history. However, if you have a UCLA primary care doctor, you do not need to bring these items. We will have access to the information we need from your doctor, so long as you've been seen within 30 days of surgery for your surgical clearance. You should bring a method of copay if your insurance requires a copay. If you have an advance directive, please bring a copy. Please bring your eyeglasses and hearing aids. Make sure you bring the batteries for the hearing aids because we do not provide those. It's helpful to bring important phone numbers or a cell phone with a charger. We will fill all of your surgical recommended medications here in the hospital and we'll deliver them to you at bedside before you leave. So please bring a credit card to pay for these medications. If you have it, you should also bring a CPAP and rescue inhaler. I'll now talk about what items to leave at home. You should leave all jewelry at home, including wedding rings. Please do not bring checkbooks or your own medications. We have a full-fledged pharmacy that will provide generic versions of most medications. Only bring your own medication if you're on a special kind of trial drug medication, you have a rare medication, or if you have a special formulation of medication that you need to take. Please make sure to bring any special medication in its original prescribed packaging with a pharmacy label on it. We cannot accept any home medications without pharmacy labeling. If you're not sure if you need to bring a certain medication, you can call Wilson and he can check to see if our pharmacy carries that medication. On the day of your surgery, your first stop is going to be the admissions office. That's G314. If you're coming through the 16th Street Valet entrance, it's right around the corner from where you enter. When UCLA tells you the time you need to arrive at the hospital, that's the time you need to be at the admissions office. Once you check in at admissions, you'll be directed to the surgical waiting area. This is where you're going to be prepped for surgery. You'll meet your anesthesiologist, sign any last-minute consents, and then they'll mark the surgical site and get you ready for surgery. Once you're ready for surgery, you'll get moved to the operating room. For an elective joint replacement surgery, you'll typically be in the operating room for about 1.5 hours. Once the surgery's over, they'll transport you to the recovery unit, also known as the PACU. This is where you'll wake up from anesthetic and they'll make sure you're stable. If you are discharged home the same day, you'll stay in the recovery unit until you're cleared for discharge. In order to discharge home same day, you have to be medically stable, able to urinate, and be cleared by our physical therapist. The physical therapist will be ensuring that you can walk household distances with the front wheel walker, demonstrate that you can get in and out of bed and a car, and that you can walk up and down stairs if you have stairs. All of this should be done with little to no assistance. We will not discharge you home unless you're safe to discharge the same day. Your surgeon will decide whether you're a candidate for same-day discharge. If you're not going to be discharged home this day of surgery, you'll likely move to the orthopedic unit if there are rooms available. The unit specializes in knee, hip, spine, and shoulder surgeries. The average length of stay on the ortho unit is 1 night. The unit has 26 private rooms. It's staffed by nurses, nurse assistants, and nurse management. You'll have plenty of qualified people to care for you while you're on our unit. Please refer to our visitor policy if you plan on having visitors to the unit. The most up-to-date visitor policy is listed in this PowerPoint. After your surgery, we will work to manage normal post-operative issues like nausea and constipation. You'll likely get constipated from the anesthetics and pain medication after surgery. It's important to take stool softeners and laxatives soon after surgery in order to avoid potential complications. We do not usually provide laxatives for home after surgery, as a variety of laxatives are available over the counter. If you are not having regular bowel movements, please utilize over-the-counter laxatives. A high-fiber diet and good hydration will also help prevent constipation. After surgery, we focus on fall prevention. Due to the nature of joint replacement surgeries, everyone is at risk for falling. While in the hospital, patients must call for nurse assistance before getting out of bed. There have been many cases where patients didn't want to bother the nursing staff, so they tried to get up on their own and ended up falling. This can damage the surgery site and even result in having to go back into the operating room. This is why we always have patients call for assistance anytime they need to get up. We really want to be there to ensure your safety. We will even take extra measures to protect you, such as turning on bed alarms or chair alarms to remind you to call for nurse assistance. Fall prevention is important for a safe, successful recovery. Another thing we focus on after surgery is preventing blood clots. Everyone after surgery will be at risk for blood clots. A great way to prevent blood clots is activity. Doing exercises, walking, moving around, and doing ankle pumps will all help prevent blood clots after surgery. You will also be placed on blood thinning medication as well. The blood thinner that we prescribe will be based on your medical history and what your surgeon recommends. For the most part, if you do not have a history of severe heart disease or a clotting disorder, then your surgeon will usually place you on baby aspirin for 6 weeks. The baby aspirin is not for pain, it's for blood clot prevention, and it's important to take as instructed. Infection prevention is another thing we take seriously after joint replacement. You'll be given IV antibiotics in the hospital to prevent infection. Good hand hygiene will also reduce your risk of infection in the hospital and at home, so make sure that you and the people caring for you wash their hands frequently. It's important to monitor for signs of infection at your surgical site. Possible signs of infection include redness, swelling, drainage, and fever. If you have any of these symptoms after surgery, please report these findings to your surgeon's office or Wilson.
The number one call I get after surgery is to report swelling along the operated leg. Swelling is expected at least 6 weeks after your surgery. The best way to reduce swelling is to elevate the operated leg with your toes above your nose. It's recommended to elevate for a total of 4 to 6 hours for at least the first few weeks after surgery. You can use pillows spaced apart low to high in order to get your toes above your nose. You can see an example on this PowerPoint slide. Another way to reduce swelling is to ice the operated leg. Not only can you ice over your incision, you can ice anywhere on that operated leg that hurts or is swollen. Pumping your ankle like you're stepping on the gas pedal while the leg is elevated also helps to reduce the swelling. It's very important that you manage the swelling throughout your entire recovery. I will now talk about day of discharge. You'll need to pass 3 requirements to demonstrate that you are safe to leave the hospital. In order to be discharged, number 1, pass all physical therapy requirements. You must demonstrate to physical therapy that you can return home safely. You should be able to walk household distances with your front wheel walker, get in and out of bed and a car, and do stairs if you have them. All of this should be done with little to no assistance. The second requirement is to be able to urinate or empty your bladder. And the third requirement is that you are medically stable and do not require hospital observation or treatment. We will plan to discharge you once you have met all three of those requirements. If you do not meet those requirements, you may be hospitalized for longer or may be discharged to a rehab facility for further care. If you are going home the day of surgery, make sure you have your ride home on standby for when you are cleared from the recovery unit. It would be helpful for the person assisting you at home to be present to watch you work with the physical therapist and listen to the discharge instructions from your nurse. If you are discharging home the day after surgery, we do have a discharge goal of 11 a.m. This time may vary based on your clearance from your hospital team. On the day of discharge, we will give you discharge instructions including when you can shower, when you can drive, how to care for your incision, when your next follow-up appointment will be, and the reasons to call your surgeon's office or myself. You can look at an example of your surgeon's discharge instructions in the attachments we sent you with this class video. On discharge, we will also go over your therapy plans. Your therapy may be just going home to continue home exercises, it may be going to outpatient therapy, or you may have home therapy. We will take the recommendations of your physical therapist to create a therapy plan. We will be able to fill all your medications in the hospital. Please make sure you have a credit card ready for your copay, so the medications can be delivered to you at your bedside before you go home. Now we move on to the pharmacy portion. You want to make sure your orthopedic team and your primary care doctors are aware of any medications or adhesive allergies and what the reactions to those allergies are, because we want to make sure everything we're giving you in the hospital will not cause an allergic reaction. We also want to know everything you're taking, so we want to know what prescription drugs you're taking, over-the-counter medications, vitamins, and herbal supplements. In general, we want you to avoid all medications or supplements that will cause blood thinning effects. Aspirin is a blood thinner, and NSAIDs can thin your blood also. NSAIDs means non-steroidal anti-inflammatory drugs, and this class of medication includes ibuprofen, naproxen, meloxicam, Celebrex, Aleve, and diclofenac. You want to stop these 2 weeks before your surgery. If you are already on blood thinning medications, you should discuss a stop and resume date with your primary care doctor or specialist that has prescribed the blood thinning medication for you, such as your cardiologist or hematologist. In general, things like fish oil, ginger, and turmeric all have blood thinning effects also. We like you to stop those 2 weeks before surgery as well. You do not want to bring your own personal medications unless it's one of the criteria that we talked about earlier. To prevent postoperative infection, the most common antibiotics we use is called Ancef, also known as cefazolin. It's part of the penicillin family. I do advise that if you have a penicillin allergy that happened many years ago and you have time before your surgery and you are willing to check it out, it's a good idea to see your primary care doctor who can refer you to an allergist and to actually see if you're cleared from that allergy. Penicillin is one of the best antibiotics to use to prevent surgical site infection. We do, however, have a bunch of other antibiotics we can use in place of penicillin in case you do have a penicillin allergy. I'm going to talk about how to best protect your joint from infection if you are having any procedures after surgery. We do not want you to have any dental work or invasive procedures for 3 months after the date of surgery. An invasive procedure is defined as a medical procedure that enters the body, usually by cutting, puncturing the skin, or by inserting instruments into the body. Some common examples are all dental work, including dental cleaning, colonoscopies, and deep skin tissue removal. You can always call myself or the surgeon's office to clarify if a procedure is invasive or not. In the case of an emergency within 3 months from surgery, we can prescribe preventative oral antibiotics prior to the procedure. Please let us know if you have any emergency procedures within 3 months of surgery. After 3 months from the date of surgery, you should take antibiotics to prevent infection with all dental work, including dental cleaning, and for all invasive procedures. When you go home from the hospital, your surgeon will give you specific instructions as to how long you should continue this protocol. If we're talking about blood draws or shots for immunization or flu vaccines, you do not need to take antibiotics. So in terms of pain control, we have a number of pain medications that we use to control your pain after surgery. The most common ones we're using are tramadol and oxycodone. Your job is to tell us what's working for you and what's not working, so we can figure out what will work best for your pain control when you go home. If you have taken narcotics in the past and know what works for you and what doesn't, or what causes you certain side effects, make sure you share that information with us so we can properly prescribe for you after surgery. For non-narcotic pain medication, we will commonly prescribe Tylenol and an NSAID to help control your pain as well. While on these medications we prescribe for you, please do not take any additional pain medication unless approved by your surgical team. There can be some side effects from the medication you will be taking after surgery. These side effects include nausea, vomiting, constipation, trouble sleeping, or acid reflux. And your job is to tell us if you're having any of these issues so we can help control or resolve them. In terms of blood thinning, again, everyone after surgery is at risk for developing a blood clot. The most common medication we use to prevent blood clots is aspirin 81 milligrams, also known as baby aspirin. Your surgeon will select the most effective blood thinning medication for you after surgery, and this will also be dependent on your medical history. This will be the most important medication you take, and you'll usually take it for a full 6 weeks after your surgery, unless instructed otherwise by your surgeon.
Hello, my name is Troy. I'm a physical therapist here at UCLA Health. Physical therapy will likely begin the day of your surgery. Usually within a couple of hours after surgery is done, one of us will be there to see you. The goal for many of you will be to go home the day of surgery. In this case, we'll see you in the recovery unit. If your surgery is planned for later in the evening and you stay overnight, we'll follow up the next morning on the orthopedic unit. On this initial visit, we will help you sit up, stand up, and walk using a walker. If you have stairs at home, we'll also practice those before you leave. If you do end up staying the night, we will see you the next morning to work on the same things as previously mentioned. We can also review any of your exercises and answer any other therapy-related questions. If there's someone that's going to be taking care of you, we can provide some caregiver training for them as well to make sure that they feel comfortable taking care of you. If all of your goals are not met that following morning, or if you are staying longer for any medical reasons, we may see you for a second session that afternoon before then going home. The primary focus from physical therapy after surgery is to focus on safe discharge, which includes progressing safe household level mobility and walking, stair and step training if needed. We can practice a curb step or a flight of stairs, depending on what you need to return home safely. And car transfer training. We have a car simulator on hydraulics that can be used as needed. Caregiver or coach training. It would be helpful for you to have your caregiver at bedside to observe and participate during your physical therapy session. Post-operatively, pain control is very important. Make sure that you stay ahead of your pain and take your pain medications when they're scheduled. We usually say an ideal pain level is about 4 out of 10, with 10 being the worst pain you can imagine. A pain level higher than 4 may be too high for you to successfully participate with physical therapy. In order to get the most out of your physical therapy session, make sure you finish up any meals, phone calls, or visitors before we come. You are encouraged to have one visitor who will be your coach at discharge to participate in therapy sessions. You may want to also use the restroom before your physical therapist comes. Again, make sure to take your pain meds.
So now we're going to talk about getting in and out of the bed. So you can go to either side, but if you have the option to go toward your non-operated side, then let's do that. It may be easier. So in this case, I'm going to say my left leg is my operated leg. So it's better if you try to sit up first onto your hands, move your good leg off the bed, and then bring your operated leg over. Continue to walk yourself around using your arms. And then scoot forward till your feet are on the floor. At this point, we have our walker. We want to bring your sore leg forward, your good leg underneath you, at least one hand on the bed to push up from, not both hands on the walker. You're gonna lean into your good leg and push up, bringing both hands to the walker. When you go back to bed, the opposite. Bring your operated leg forward, reach back, have a seat. Walk away. You're gonna sit back onto your hands, push yourself back. Push yourself back. At this point, you can move your operated leg in. This leg is fine. You can use it to help you. And then lie back.
Hi, my name is Amy. I'm one of the occupational therapists here at UCLA Santa Monica. I'm going to be taking you through what your occupational therapy session after surgery will be like. And I'm also going to talk to you a little bit about how to prepare your home and yourself ahead of time so that when you return home after surgery, it will be easier for you. If you will be leaving the day of your surgery, then you may have a visit from occupational therapy that same day, along with physical therapy. If you stay in the hospital overnight, occupational therapy will start the day after surgery, and we'll see you for one session before you go home. In occupational therapy, the focus is on dressing yourself, moving in and out of your bathroom, making sure you can get on and off the toilet, perhaps doing a shower transfer if we are able. If there are any home skills that you're kind of wondering about, this would be a good time to talk about them with the OT. So we'll talk about all of the activities of daily living that you would like to be doing as soon as you get home and as you recover, and the easiest and safest way of doing things. Before your surgery, it's important to prepare. You'll want to make sure that you have a good support system in place to help you with making meals, bathing, transporting items, driving you to follow-up appointments and possibly outpatient therapy, and getting around the house. Also other things like laundry, animal care, and house cleaning. You are going to be in charge of getting up, walking, and doing your basic self-care. Outside of that, you'll need help when you return home after surgery. So this person that you agree to be your coach or caregiver should be family or a close friend. If you need to hire a caregiver, this would be something to do ahead of time to make sure that you don't have to worry about that while you're in the hospital. And then if you need any services for your home due to the fact that your mobility is going to be limited at first, you'll want to arrange that ahead of time. If you do not have a walker, one will be provided to you in the hospital. Other items that we sometimes recommend are a commode, raised toilet seat, a shower chair, or bench. We do not suggest purchasing a lot of equipment before surgery, as it's best to see what you are comfortably able to manage once you've had surgery, and so we will trial these things with you here. One thing to do before surgery is walk around your home imagining that you have a walker in front of you. For your knowledge, a standard walker is between 23 and 24 inches wide. Pick up any small area rugs that may trip up a walker or any clutter on the floor. Confirm the walker would fit into the bathroom. Choose the easiest areas to mobilize to and from the bathroom, which may involve staying in a different room of the house. If your bedroom is upstairs, you will most likely be able to access it right away, as most people are able to get up and down a flight of stairs after the procedure. It's just something you may not want to do more than once a day at first. Here are some devices and equipment that you might consider, but they're not necessary, just wanting you to know what's available. You know your own home, so you know what will be useful to you. As far as safeguarding the bathroom, we do recommend grab bars in the shower to make it safest for transfers in and out, and also grab bars by the toilet to increase ease if possible. If you have or can install a handheld shower hose, these are very useful after surgery to be able to control your shower. Use a rubber-backed bath mat and a non-slip mat outside the shower. Safely setting up your home involves a few ideas we have for you here on this slide. Make sure you have plenty of room to walk about with your walker. Keep things you use often within easy reach, so if there's a place you know you'll be spending most of your time after surgery, such as a recliner chair, your living room, or maybe your bedroom, you might keep your phone charger, your books, maybe your iPad or Nook, maybe some water bottles and small snacks, things like that. We do want you up and moving after surgery, but what we don't want you doing is transporting things while using the walker. So if you have your things already set, it makes it a lot easier for you to stay safe while you're recovering. Proper shoes with a back on non-slip soles are important after surgery. We discourage flip-flops or slippers without a back. Also, if you have a low sofa or low chair, consider adding a firm pillow to increase ease and safety for sitting and standing from it. And if you have small pets, and especially if your small pets like to bring small objects onto the floor, it would be good to make sure that during the time that you're walking in those areas, perhaps those pets could be sectioned off in some way so that you don't risk tripping over an item or a pet that likes to get underfoot. These are things we can further review if you have specific questions when we meet you after surgery. Thank you.
Now we're going to talk about case management. It is very important to make sure that you have someone or multiple people to help you for the first week or two after your surgery. The time frame as to how long you might need a helper may vary based on your condition before and after surgery. It's very important that you find someone flexible in this regards to assist you. This person or persons will assist you with navigating your home safely, driving you to your appointments, and encouraging you to perform your exercises safely. So you want to start looking for this helper or helpers before you come in for surgery. It's very important to your joint replacement recovery that you have social support. After hip replacement, we want you to take it easy for the first 6 weeks to allow your surgical site to properly heal. Based on your surgeon's protocol, you may be recommended to continue with home exercises or outpatient physical therapy after your surgery. If your physical therapist finds that you require additional support to be safe at home, your therapist can recommend home health services, and our case managers can set that up for you prior to discharge. Most patients will be able to go straight home and continue walking and the light exercises that we give you. Very few patients need to go to a skilled nursing facility after their hip replacement. Patients that might need to go to a skilled nursing facility are those that are recommended for skilled nursing facility level of care by our physical therapist, surgical team, or medical team. Also, patients that need 2 people to assist each time they walk or get out of bed, or not being able to walk or climb steps, frequently losing your balance, or medical issues that require skilled nursing needs. Medicare, as of January 1st, 2020, removed hip replacement from their inpatient only list. What this means is this procedure is now an outpatient procedure from Medicare's eyes. Unless there's a medical issue after your surgery, a risk for complications, or high risk before surgery. So we're treating all these cases now as outpatient procedures. So Medicare and most other insurance companies require us to show medical justification on why we need to keep you in the hospital and why we're sending you to a skilled nursing facility. We cannot promise you can go to a skilled nursing facility unless there's medical justification. Medical justification can only be made after your surgery. Typically, insurance will not consider social reasons as a reason to go to a skilled nursing facility, such as you live home alone, you have a small apartment, and you have no one to help you after surgery. Those are all social factors that can be addressed prior to your elective procedure that you're going to have here at UCLA Santa Monica Medical Center. So I want you to take this time to really prepare and decide who's going to help you after your surgery. It could be that someone helps you on one day and another person helps you on another day. We expect before you leave the hospital that you can walk household distances with the walker, you can get in and out of bed, you can get in and out of a car, and you can do stairs in order to get into your home with little to no supervision. In terms of medical equipment, Medicare and most other insurance will cover a front wheel walker. All other equipment like shower chairs and bedside commodes through Medicare are typically not covered. If you have commercial insurance and you need equipment other than a front wheel walker, we can submit it to your insurance company. Commercial insurance tends to have a better chance of covering those items if recommended by our physical therapist after your surgery. So if you decide you need them after working with our therapists, you can potentially go out and buy them on your way home or order them online. If home health services are recommended for you after surgery, we'll set it up. For a home health agency, they'll see you within 24 to 48 hours of you discharging from the hospital. The nurse will see you first, open up your case, and then the physical therapy will come, and they often see you for 4 to 6 sessions within that 2-week period. Home health is dependent on insurance, location, and staffing of the agency. If you have a medical need to go to a skilled nursing facility, they will usually provide 12 hours of physical and occupational therapy per week. That breaks down to about 2 hours a day for 5 to 6 days until you're ready to go home. A skilled nursing facility is a facility that you will be discharged to and stay there until you are cleared to safely go home. You'll most likely have a roommate because in order to get a private room at a skilled nursing facility, you will have to pay extra per day. If you believe that you will need to go to a skilled nursing facility, please call me to discuss and plan. I always recommend that if anyone believes you will qualify and need to go to a skilled nursing facility after surgery, to research them and even go take a tour of them. If you find that you need extra help and are thinking about hiring a private caregiver, most insurance companies will not cover this service. These are non-licensed professionals that you would hire on an hourly basis to come and provide care for you at home. They can help you with incidental things that we talked about, such as helping you with cooking, cleaning, helping you go up and down the stairs, taking out the garbage, and things like that. They're trained to help care for patients after hospitalizations. On average, they cost $35 an hour. Listed here are 3 companies out of many companies out there. Definitely call around and shop for rates. You can interview ahead of time and no commitments necessary. You can hire anywhere from 4 hours to 24 hours. You can even hire the day after your surgery, and you can end service anytime. Here's my contact information. Anytime you need me, you can contact me on my work cell number. That's the best number to reach me at. You can also text me at that number. I also have my office phone, email, and pager information on here for you. So if you have any questions on or concerns after watching this video, please do not hesitate to call me. Again, I will be following you from this point on until 90 days after your surgery. I will typically see you in the hospital as well before you are discharged. Thank you.